Dr. Juliana Simonetti is here from the University of Utah Health, and she joins us with surgical and non-surgical ways to lose weight. We've all been in this space, haven't we, where we've put on the pandemic pounds?
I know. I kind of like the word pandemic pounds, kind of it goes together very well. Yeah, no, I feel like we all have been in this space. I feel with, being home more, either working or with our kids and having access to food, right? The kitchen is right there. So sometimes I'm working, I was like, oh, I can just go in the kitchen and get a little extra something. In addition to the stress, so I feel like heightened levels of stress, right, we all have this underlying level of stress, and the stress really leads us to crave more sweets and high carb foods. And one of the reasons why is because when we eat those foods, it releases the feel-good hormones in our brain, which are dopamine and serotonin. So, right, when I'm feeling really stressed, I want a piece of chocolate or like a piece of bread. And when I have those things, I immediately feel
better.
I feel better, right? Physiologically, you feel better.
But not good for your body.
Not good for your body. And the more you have it, the more you want it. So that comes the snowball kind of effect of the weight gain, in particular when we're home.
Well, and we should also mention, I thought this was so interesting, that obesity increases your risk of contracting COVID-19.
Yeah, so increases your risk of having more serious symptoms. So what they have done several studies now that have shown that obesity is definitely one of the risk factors for having more severe COVID-19 infection. And one of the reasons they think of why is because when you have excess weight, you might have increased sugar and insulin in your body, which is more likely linked with inflammation. So if you already have kind of this inflammation in your body and you get the virus, you're more likely to get more sick and develop pneumonia. And the other issue is that oftentimes those with severe obesity might have problems breathing, and with the infection, with the virus infection, they are more likely to get really sick. So I think this is a perfect opportunity. We should take this opportunity that we're home to kind of focus in our health and in good nutrition.
What do you suggest?
I feel like avoid the triggers, right? So even though I'm really tempted to bake more cookies and buy, the potato chips at the market, maybe we want to focus on having healthier foods, more veggies, more fruits. And I think the summertime is a perfect time for that. I just saw that the downtown farmers market is opening this weekend. So it's a great place to get fresh fruits and vegetables, look at new recipes, so make it exciting, right? Healthy food doesn't have to be boring.
It's so true. If you have the chips out, you're going to eat the chips.
Right.
If you have the broccoli out, you're going to eat the broccoli.
Right.
More physical activity.
More physical activity. So, right? The weather hopefully is getting nicer this week, so we can all be outside, even if it's for a 5-minute walk, not just for physically, but for our mental health. That's really, really important. There's tons of apps. I have started using apps where you can pick them out of time. Like, so if I have 10 minutes, I might have, I might do yoga for 10 minutes, or I might do a little bit of exercise at home for 10 minutes. A lot of them are free.
5-minute ab workout. Right?
Right.
Anything like that. I know also that the Sugar House Health Center is where you're located, and you have help, a comprehensive weight management plan. If someone's sitting out there going, I just need a little push.
Yeah. So I think it's really important to know that there are more to weight gain than just diet and exercise, right? There's multiple causes of why we gain weight. Sometimes, right, excess stress, anxiety, depression, lack of sleep, all those things contribute to weight gain. And we try to give patients as many tools as possible to address as many of the issues. So we have a truly multidisciplinary team with the medical and the surgical side. We have, I think you're showing the images now, some beautiful gym. We have a demo kitchen. We have, rooms that were specifically made for our patients. We have equipment that measures resting metabolic rate. So we have so many tools to help everyone. It's kind of like one-stop shop. From medical to surgical, we're all in one place, and we all work together to develop an individualized plan for our patients, and I think that's key.
If you have felt frustrated, everyone, if you have questions, they have answers for you. Sugar House Health Center, all the information from University of Utah Health is right there on your screen, uofuhealth.org/weight, and we can link you from our website to make it easy as well. Dr. Simonetti, thank you so much.
Thank you so much
for joining us.